Home and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hafa and welcome back to Health, Home and Lifestyle. I'm here in studio with Barbara Mofness and Carla Haddock to talk about the upcoming Breastfeeding Awareness Health Fair happening this week, Saturday. So for those who don't know anything about breastfeeding, maybe nursing mothers, or even mothers who are already nursing, what should they know about this upcoming health fair?
Well, it's an exciting event, and it's just a way to promote, protect, and support breastfeeding, which is what we do.
Okay, and so I know that you're, Carla, a mother of 6 and also a working mom. So tell us a little bit about your experience with breastfeeding and what you hope other women might learn from your experience.
Well, my first child is about 13 years old, so I feel like for the past about 13 years I've been breastfeeding my 6 children, and each and every child is a whole different experience. And you would think as a mom of 6 and a nurse, I'm the subject matter expert, but I can tell you that it's not that easy. And that's what's great about these breastfeeding fairs, is that you really can go and network and kind of get the support that you need. And it's not easy to breastfeed. And I thought, oh, I'm a nurse, I got everything, but really I needed to rely on that network that I built through these fairs and through lactation consultants in order to be successful.
Okay, so Barbara, you're one of only a few lactation consultants in Guam. So can you tell us a little bit about what you do and what are some of the concerns you hear from new mothers?
Well, one of the things that I do is I hold support groups. Actually, we've renamed them as socials. And it gives a mom a forum or an activity where she can come to and meet with other moms and hear about maybe their difficulties and their struggles. And then that builds on their empowerment and it helps them to understand. And basically what I do is facilitate the groups. And if there's any questions or concerns, then my expertise comes in and I help them. Sometimes I have moms come in that they have perceived milk supply issues, and so I help them to latch their babies. And basically it's just a confidence boosting thing that I do, believe it or not.
Okay, so maybe you can help me kind of understand. You know, we always hear how healthy breastfeeding is. So why would mothers decide not to breastfeed, and why should they decide to breastfeed?
Well, there's so many benefits to breastfeeding, and everybody knows the benefits to the baby, but we forget about the benefits to the mom. Right after she has her baby, it helps with postpartum bleeding. It also helps with postpartum depression because she's releasing hormones called oxytocin, which is the love hormone. It helps her not to, or she's not so likely to have postpartum depression. Prevents ovarian cancer, can reduce breast cancer issues later on in life, and environmentally it can help as well too. I mean, there's other benefits. It's not just to the baby, it really benefits everybody as a whole.
Okay, and when it comes to, you know, it's like you said, it's not easy breastfeeding, and especially you're a working mom of 6. What was it like going back into the workforce?
So I believe going back into the workforce was the hardest part, and that's often when mothers tend to give up, is when you have to go back. But no mother should have to choose between their career and raising their family and feeding their baby. And so that's why we, you know, now we have legislation that helps to protect the mom when they choose to go back to work. And like I said, the coming out and finding what networks, what techniques exist can really help to benefit the mom, because pumping milk is not as easy as just latching the baby on and feeding the baby. Right. So you have to have that will, that desire, and that commitment to do it. But it's not impossible, and it's not life-draining. I mean, I worked on the floor 12-hour shifts as a nurse. And luckily I had the great support of my coworkers who'd help watch my patients. I had the support of my lactation consultant to kind of develop a schedule for me, and I was able to go back to work and successfully breastfeed. If I didn't have those resources and I didn't know, I'd give up. I honestly would, because it's that easy to just say it's hard. But the reward of being able to breastfeed and feed your child and supply is wonderful. And I realize not everyone can breastfeed, but I think you need to have an educated decision. You need to know what is available to you, what your resources are, in order to make that informed decision.
And so Barbara, can you tell us how long should mothers consider breastfeeding their children?
Well, the American Academy of Pediatrics, the World Health Organization, and a lot of other organizations suggest that moms breastfeed for at least 6 months, but the goal is to be a year.
Okay, and so is this because it provides the nutrients that the children need?
And it's optimal health for the baby, right? Giving the baby optimal nutrition.
Okay, so what kind of support groups or different service providers will be at the fair happening this week, Saturday?
Well, we've got Mariana's Physicians Group, we have the lactation League, we have, help me out here, FNAP is coming.
We also have WIC that can help assist with nutrition for the mom while she chooses to breastfeed. And there's immunization will be there, public health, of course, will be there. So there's a lot of different venues that can kind of give their take on keeping the mom, keeping the baby healthy, and what support they can give to breastfeeding.
We have 23 vendors at this point.
Okay, so when and where is this fair taking place?
Saturday, Micronesia Mall, 10 to 2.
Okay, and so, you know, you, as an experienced mother who's breastfed several of her children, 6 of your children, can you tell us, you know, why is it important for those who think, oh, I can do it on my own, I don't need any help? Do you think it's helpful to go to a fair like this just to find out more information?
Absolutely. I can say 100%, each child was a whole different breastfeeding experience. And even though I had the resources from the previous child, I needed that support from fellow mothers even to just kind of reassure me, yes, you're doing it correctly. Look at your baby's growing, your baby's gaining weight, and you're doing it all on your own. Sometimes you just really need that. And then you need to know what's out there. I mean, in the past 13 years, there's so much that has changed on Guam. I mean, just even think about the vendors out there. And, you know, before we could never have breast pumps readily available. And now all of a sudden we have several stores that carry that. Even just something as simple as that.
And different choices of
brands.
And
different choices of brands. I mean, 13 years ago you had nothing. And now your insurance companies can offer it to you. So, I mean, definitely, absolutely come out.
Yeah. Okay, and last thing, so if people are unable to attend this fair, where can they go for more information about breastfeeding?
Well, we hope that all moms, before they pick up a bottle, will pick up the phone and maybe give me a call. My number is 777-6526. They can call the hospital, they can call the WIC office, and we have other resources as well, too. We'd like to connect them with the community.
All right, well, thank you so much for joining us. Stay tuned, we're going to have more health, home, and lifestyle after the break.